Hi, my task at this meeting was to speak about corneal inlays and their current use in Europe. So what we found is that surgeons who have implanted these inlays report a wide range of experiences, from complete failure to enthusiastic success. And there are possible causes. Some of them are which inlay models were used, at which time in the evolution, what the techniques were, how deep they were, what lasers were used to do this, and the timing. Was this very early on in the evolution, or was it later once there'd been a lot of understanding of how these factors work? But the key message is there's a wide range of experience with corneal inlays. So I wouldn't think that my opinion carries enough weight to tell you what I think. So what we did is I'm going to share with you the findings of the Refractive Surgery Alliance survey. So anecdotally, there have been reports of high rates of complications. And due to the time it takes for peer-reviewed literature and the limitations of post-approval studies, the RSA leadership decided that it was sensible to do an inquiry. And this was done online. It needs to be noted that the RSA accounts for some of the most experienced refractive surgeons in the world as their members. And I think what's very important too is, despite their experiences and their commitment to the field, there exists a significant range of opinions regarding the approved corneal inlays for presbyopia amongst the RSA membership. So it's important to note that there are people who have used the inlays and had not had good results and have stopped using the inlays. It's equally important to note that there are surgeons who are still using the inlays and even considering them for their own eyes. I think it's very sad that Revision Optics is no longer with us, because this was a company with great approach to the whole field, to the whole segment, and trying to grow the market. But they're no longer there. So surgeons who were using their device, the Raindrop, there are fewer surgeons using it now without the company's support. In terms of camera, there are some surgeons who are using different techniques and are finding very good results. I think in the spirit of ACOS, what we need to do is look at the three pillars of ACOS, which are innovate, educate, and advocate. So the very first part, the innovation part, is we need to continue with innovation. And I think one of the big innovations in the future is going to be the material. And from what I can see is the use of allografts, real corneal tissue, is going to play a big role in this space in the future. I also think for our colleagues who are still using inlays, it's important to support them and their quest to find better approaches and better techniques. The second element is education. I think it's very important when we do learn something from a particular procedure that we share this knowledge. We like speaking about our great results, but we're not that keen on speaking about less than stellar results. And I think in the spirit of education, we need to tell people when we've run into trouble and we can avoid the same problem for them. And then the last and final thing, which is certainly not the least important, is the role of advocacy. Ultimately, we're our patients' advocates, so we need to do what we think is in their best interest. So it is a difficult lecture to give, given the wide range of experience with inlays. I think one of the key issues with inlays is the fact that they are removable, and this is one thing that does give us the opportunity to try them for the patient where it does make sense.